Here's a case of a 73-year-old male basically complaining of pain over the Achilles tendon on the left side. There was somewhat of a language barrier making the history somewhat difficult, but physical exam was mostly positive for pain over the Achilles tendon. Here, ultrasound was able to confirm that he did have a tendinotic, boggy, heterogenic type Achilles tendon, which was confirming our clinical suspicion.
Here we're going to review some of the anatomy involved in this case. Here, essentially just looking at the bones with the interosseous membrane. On this demonstration, we're just going to focus on the posterior aspect of the leg, specifically around the Achilles tendon. Now we'll bring in some of the deep musculature into view. You can see the flexor hallucis longus, tibialis posterior, flexor digitorum longus going from a lateral to medial direction. Here's some of the neurovascular structures as well. Now we're rotating, and you can appreciate the tibialis posterior tendon, flexor digitorum longus tendon, flexor hallucis longus tendons on the medial aspect of the ankle with the neurovascular structures as well, which are comprised of the tibial nerve and the posterior tibial artery and vein. Here we're bringing the Kager's fat pad in view, as well as the soleus muscle, and now we're bringing the gastrocnemius muscle into view as well. And this is essentially a normal Achilles tendon. You can appreciate how flat and white it is, and fairly consistent in thickness throughout its distal course, which is basically thin, consistent with a normal Achilles. You can appreciate the plantaris tendon as well on the medial aspect of the Achilles tendon. Here is this tendinotic tendon. You can see that it's somewhat bulbous in shape in the distal aspect of the Achilles tendon. The actual insertion is fairly normal in thickness, but as you go somewhat proximal, you can see this thickened bulbous Achilles tendon, which is labeled accordingly. And again, here we're focusing on the tibialis posterior tendon, flexor digitorum longus, and flexor hallucis longus tendons with the tibial nerve and posterior tibial artery and vein between the flexor digitorum longus tendon and the flexor hallucis longus tendon. And here we are zooming out.
This is our patient, a 73-year-old male, here for pain in the left ankle. I saw him about 8 months ago for an acute sprain, and apparently got better, but over the past couple of weeks it seems like he's been having more pain. Hard to get a clear history as there is a language barrier, but it seems that most of this pain is in the Achilles tendon proximally. He has a negative Thompson sign. He had an MRI which showed a partial tear of the distal Achilles with some tendinosis in that region, and didn't comment on the proximal Achilles tendon. He just did a quick ultrasound. It looks like he has tendinosis in the proximal tendon. As you go distal, that was the proximal Achilles tendon. As you go distal, you see some hypoechoic thickening of the tendon.
And here we are just labeling the tendinotic part of the Achilles, which is this darkened, thickened, hypoechoic part of the tendon, somewhat proximal to its insertion. You can see Kager's fat pad underneath that.
Here, right there. So this is where he's most tender, and you can see this is where the tendon is very thickened and boggy, consistent with pretty severe tendinosis of the proximal Achilles tendon. And I think that's really what's going on. Here's this distal Achilles tendon. Nothing major going on there. It does have some retrocalcaneal bursitis.
And this, I believe, is just a minimal case of retrocalcaneal bursitis, as the bursa is just slightly enlarged.
So I believe this is his main pain generator. If you just reviewed his MRI report, you wouldn't have picked up on this finding because it wasn't commented on. So this is one case where ultrasound can change your management. Go from, I'm going to do axial view.
And here's essentially a normal-looking distal Achilles tendon, normal in thickness and normal in echo texture as well.
Right side of the screen is medial. We're going proximal. And this is kind of his zone of tenderness. Get tender here. And we're going even further proximal, and this is where he seems to be okay. (1054) Again, we're starting proximal, now going distal. And you can see basically the medial part of that tendon is very thickened and boggy, abnormal looking tendon.
And this view, I believe, demonstrates his pathology the best. You can see the thickened, irregular tendon medially, consistent with tendinosis. And also there is a component of tendinosis on the superficial or posterior aspect of the lateral Achilles as well.